Bonjour.
Justin Trudeau this morning talked about two planes that went to recover protective material in China that came back empty. One was going to the federal government and one was going to a province. Was it Quebec? And if it was the case, what are the consequences? No, it wasn't Quebec. Okay, my other question is, yesterday you spoke of the fact that people expressed that they were very tired of being at home. We can see in the United States there's even anti-confinement activities going on. Of course, we don't expect that in Quebec, but are you expecting negative reactions over the next few weeks? Well, you have to really be disconnected to not see that people are tired of being at home. I think denying that would be to deny reality. Now, it's like the lesser of two evils. We don't want those people to all come out at once and start seeing other people, and that the spreading, multiplies over the next few weeks. It's possible, and I've said it often. You can go have a walk, you can keep 2 meters away from other people and wash your hands. So there are ways of leaving the house while respecting certain rules in order to avoid the spread. Now, we'll get to it, but Dr. Arruda said it yesterday. What do we do with homemade masks? Could that help? Could, for example, somebody who is not autonomous and who needs somebody to accompany them, physically, could that person wear a mask when they help that person physically? Those are possibilities that we're looking at, but we're being very prudent before opening things up too quickly. But I get it. I don't want us to end up with huge mental health problems over the next few months. So at some point, slowly we'll have to deconfine.
Merci. Maintenant, une question d'un média qui n'a pas de bureau ici à l'Assemblée nationale, qui provient de Martin Busutil, RNC Média.
So, another question. If we exclude the specific cases of CHSLDs and the Montreal region, the situation does seem visibly to stabilize in the rest of Quebec. Right now, millions of Quebecers are waiting to know more about how things are going to unfold while respecting the isolation rules. You often refer to the better days that are coming up, but in fact, there hasn't been, we haven't talked much about the deconfinement and the recovery of the economy. At one point, are you thinking about mentioning your strategy for deconfinement in more detail? Well, it's quite simply a question of data. We want to be quite sure that things are stable for a certain amount of time. There's no perfect rule. Does it have to be stable for 7 days, for 14 days? I'm looking a little at what's being done in other countries, and it fluctuates from one country to the next. But what we talk about every day is to see when are we going to be ready to have enough assurance on the stability of the situation in order to be able to gradually reopen the economy, the schools, the daycares. It is part of the discussions that we're having every day. Once we're ready to announce a plan, we will, but we're not ready now. Thank you. That completes for the questions in French. Now English.
Good afternoon to all of you. I have a question from my team working for the National. When we compare the province of Quebec with other Canadian provinces, west or east, it seems that Quebec is having a harder time flattening the curve. So basically, other provinces are succeeding a bit better than Quebec. Why do you think we are in front of this situation? I know that you talked a lot about the spring break being earlier, but I have the impression that your reflection is a bit deeper now.
First, we have to compare with large cities because the main problem is in Montreal. So it's true that it's worse in Montreal than in Toronto, but it's a lot worse in New York than in Montreal. It's worse in Paris, in London, in Madrid. It's worse than in Montreal. So there are many reasons for that, but mainly it's because of the people at the beginning who travel or didn't travel and in which countries they travel.
That's the case. In fact, you must look at different factors. Okay, first of all, there is the timing. As I was going to express, in BC, it was cases coming from China. The airplanes from China stops, so the transmission exposition was not as it was in Quebec. If we look at that's the situation of big cities, which are different. If you go to Alberta or small provinces, there is less people, less transmission and everything, and probably less traveling or airports coming from the international. We in Quebec go a lot to France, go a lot to Italy, where there was at that timing probably more people came back with this. And we had the proximity with New York, which is very important. We know that the epidemic in New York just came into Montreal and to Boisbriand community soon. So this is part of a kind of exposition that probably haven't been done in BC, Alberta, or elsewhere. And we have the specific problem of our CSSLDs. I think it will be interesting to compare which are the volumes of people in CSSLDs in Ontario comparing to Quebec. What are the ratios of personnel? Were they staffed better than we were? That's all kinds of situations that will tell us. And there is this, I would say, virus, very bad one that infect you and you have no symptoms and can transmit it. So this is the same for other provinces too, but this is part of the equation why this is happening. But I think it will be, we are still having hypotheses. It will be interesting to after really look at the facts, because in fact what was applied in the field, even if there is a recommendation for the provincial, it's always something to look at. So I think those analyses are going to be, I'm sure, done and looked at.
Okay.
And it's not clear also the number of people dying in long-term residences. Are they declared the same way everywhere in the world? It's not clear. And we know that in Quebec we test them, or by epidemiologist references, we declare all of them. Is it the case everywhere else?
No. Somewhere it's only a lab-confirmed case, and sometimes they don't do a lot of tests, so they could not confirm that case. And we have this specific situation of what is considered probable elsewhere. Here it's confirmed. It's like if I'm the spouse of a person who died from COVID-19, I've got the same syndrome and I die. Even if I'm not tested, they're going to be counted as a case. So that can influence at least one part of the difference between the province of Quebec and others, and here in Canada and on the world.
Okay, thank you. Second question. Many people ask you, Mr. Legault, to postpone and basically have the schools closed and get everything starting back over, to have the school to reopen only in September. Now you say, I don't think so. It's not a good idea. I want to understand exactly what are the dangers of having all students going back to school at the same time in September. And then, if you are creating clusters with schools, with regions, don't you have the impression that the danger of this is losing control and you are at the most delicate stage of the whole operation of reopening the economy?
The key, what I understand, and I'm not a specialist like Mr. Arruda, the key is really to open gradually. So you don't want to have 1 million children going back to school all at the same time. Because then if they contaminate, infect their parents, and that we have a big wave of people needing to be hospitalized, we'll be in trouble. So we have to do that gradually, and every week we have to test the results of this gradual opening. It's true for companies, it's true also for schools. So you have to go gradually, not put all the children and all the workers at the same time on the street.
Thank you. Next question, Samuel Pouliot, CTV News.
Hi. We spoke with the woman whose father is at the Grace Dart facility in Montreal. Her father is healthy and she wants to bring him home. but the facility is telling him that she cannot. Why can't families bring home seniors from CHSLD centers, especially when some families can handle the home care and alleviate the stress on overworked staff?
I don't know this particular case, but what we know is that when somebody is in CHSLD, it's because he's needing some help from doctors, nurses. So I don't know if they have some at home, but I would have to look at the particular case.
Yeah, I think we would have to look into that situation because we have told the population that it's possible to have a loved one come back to their home, but there are some conditions and the care also that is required by that person. So we're going to look into that situation.
Next question.
And when things start to get back to normal and people will be using public transit again, do you have any directives for wearing masks?
In fact, if we're going to open it, actually, as I told you, we will probably recommend, if the densification of 2 meters is not possible, that people wear masks. It's going to be, I would say, cover face mask with some recipes. You can find in Health Canada the way to do it. There is the ones that are better than others, but we are going to prepare a video also to make sure that, because it's not in our culture to use masks here like it is in Hong Kong or other countries, but we will recommend that. As I was telling you, if we will recommend it, but we don't forget to wash your hands and to be careful. Don't think that this protection is good for the others, because if you spill, you won't spill on others, but it's not protecting you, and use it by the right way. And we're going to make videos. It's going to be made this week. So people who I think that will be in transportation will have to use masks. It will be better to make sure, especially if you cannot respect the 2 meters. But if you are waiting for going to a grocery and you can have 2 meters in between people, keep it, your 2 meters, keep your mask, but don't try to, because you have a mask, you're going to be 1 feet, one beside the other. It's why it is important, and it's why it's going to be a measure, and we're going to try to make sure that people understand the way they use it, and I will repeat it again, don't forget to wash your hands.
Thank you. The next question is coming from Phil Autier, Montreal Gazette, for Mr. Legault. We are getting questions from teachers about opening schools. Will you impose the 2 meters in classrooms? How will that work at lunch hour in the cafeteria where kids of all ages mingle? How will you protect teachers, especially older teachers, from the virus they can get from children?
I'm not ready to answer this question, but we're looking at different scenarios, and we'll make sure to protect our teachers, for sure. So when we'll be ready, we'll explain exactly what we propose.
Thank you. And now for Mr. Legault and Minister McCann. Yesterday, you said there are 6,000 people missing from the hospitals and CHSLD residences because they are either infected or fear being infected. Can you explain what afraid of being infected means? Can healthcare workers opt to not go to work?
It's a difficult situation, and what we have to stress is that we are providing the protective equipment to everybody. We know that sometimes there have been situations where people were at the last of their protective equipment, and we had to provide very quickly because there is a planning to do in those approvisionnements. But what we have to stress is that we are providing all the protective equipment, and we can understand that some people live some anxiety, the health workers, and that's why we salute them. We salute them because most of them are at work and most of them are helping. So what we're saying is that you should talk with your bureau de santé in your organization, talk with your manager if there is something that is creating anxiety, and if possible, come back to work with the protective equipment. So most of the workers that are away from work are the workers that are, well, pregnant or immunosupprimés or have to have a test or have been infected. But there are some that might be afraid, and I invite them to discuss it with their Bureau de Santé, and I tell them we have all the protective equipment to protect you.
Thank you. Now a question from Raquel Fletcher, Global News. 1 in 5 healthcare workers in Quebec have been declared positive for COVID-19, and we've seen our first death of a healthcare worker in a long-term care residence. You've said yourself many people are afraid to go to work. What is your reflection, your feeling as a leader having to send people into those frightening conditions?
I don't think it's out of 5 workers who have been infected. It's much less than that in proportion. We have 4,000 workers, and we have probably 250,000 workers in the health network. So the proportion is much less. Still, I think about it every day, and I want to support. We want to support very much the workers. I think they are the ones to be saluted. That they go, they treat, they take care of people, and I want to tell them also that we are sending more people to help them, because in CHSLD, in long-term facilities, what's going to be helpful is to have more staff. And we see that we've mentioned today there are workers, there are students, even les entreprises d'économie sociale, they're starting to come in. So there is an effort. So I think that's going to make a difference. And we will also continue to organize teams of prevention of infection. That's very important. This is a new situation. You have to reorganize how you work, and it's more demanding. But as time goes by, we are really supporting better those teams. We are sending people who are experts in prevention of infection. So we're doing everything we can to support them.
And one very last question for Global News. Prime Minister Justin Trudeau was also asked this morning about health workers being forced to reuse personal protective equipment. Is this happening in Quebec? What else can we do to better protect all healthcare workers?
No, I don't think that's happening. Reuse, perhaps when, for the N95, we have now ways to disinfect them. So they can reuse it when it's disinfected. But otherwise, we have the equipment now to give them protection. So there's no question that you don't reuse a mask that is not disinfected. And the only ones that can be disinfected are the N95. And the masques de procédure, you have to throw them out after you've used them. And we have also les visières, that you put in front of your face. The blouses, it's improving. We're going to make blouses in Quebec. We're going to be much more autonomous. We're going to make masks in Quebec. So what I'm saying, and we've made great efforts, the government and the ministry, to really improve the situation in protective equipment. So there's no question you're not reusing equipment that has not been disinfected, and disinfected is the N95, it's possible, and the blouses, some of them will be washable and we'll be able to disinfect them. But otherwise, you don't reuse. And the visière, obviously. The visière you can wash also. But you don't reuse les masques chirurgicaux.
So thank you very much. C'est ce qui complète pour cette conférence.
This completes today's press conference. See everyone tomorrow.